public affairs, politics, opinions, and discussion. This is The Issue on YourTV. I'm Mark Carr, and on this edition of The Issue, we'll be discussing the growth of dementia needs in our community with Acclaim Health. But first, I'd like to introduce my co-host this week, Wendy Rinella, CEO of the Oakville Community Foundation. Wendy, let me turn it over to you to voice your land acknowledgement and introduce our guests today.
Thank you so much, Mark, and it's great to see you again and to be back on The Issue. It is the 202nd anniversary of Treaty 22 in Oakville, and we're also on Treaty 14 lands with the Mississauga of the Credit. You can see their flag in the back. Very, very pleased today that Melissa Cameron, the Director of Development and Marketing with Acclaim Health, is here with us. And I'm just going to turn it over to her to give us some of the basics. Who is Acclaim Health? What's dementia? Kind of give us a little bit of those foundational backgrounds, if you could. And Melissa, welcome today.
Thank you so much, Wendy and Mark. It's great to be here. Acclaim Health is a local charity. We serve all of Halton region. And primarily we serve older adults, so people who maybe need a little bit of assistance. And our goal is to really make sure that people can live well and live at home as long as possible. That's where people want to be. They don't want to go to long-term care until they absolutely have to. Nobody wants to go to the hospital unless they have to. So with all of the supports that Acclaim Health offers, we can keep people living at home and living well with their families.
Great.
And yeah, and a lot of what we do, a big part of what we do is dementia care. So that is something we've certainly seen increasing in Halton and everywhere. Part of that, it's a function of the aging population. So that need for dementia care is really key, because if you've had any experience with the disease, you know that when you have dementia, that person requires a lot of care. And that care can stretch over a decade or more. And if you're a family member and your husband or your wife or your parent has dementia, you're looking at a 24/7 caregiving job that is not only physically taxing, but it's really emotionally taxing as well, because you're kind of mourning the loss of that person you know and love. So those two things combined can really break a family almost if you don't have supports in place. So really, Acclaim Health offers a wide variety of things to support families through that dementia care journey, make sure the person with dementia gets to live well, and make sure the family gets to live well at the same time.
Melissa, if someone has a family member who they think may have early onset dementia, what steps should they be taking to help the individual and help the entire family?
Yeah, early onset dementia is even more nefarious than just the regular kind, because typically people can be a lot younger, and we do have clients in their 40s or 50s with that early onset dementia. And the caregiving challenges for that, it can be even worse, because you may have teenaged kids at home or university aged kids at home. The spouse may be working still, and how do you manage those care needs with all of that happening in the family unit? And for the person with that disease, it's just devastating, right? You think you're going to be able, you still have a lot of life left, and of course you still do even when you do have the diagnosis, but it changes your future quite dramatically. And really at Acclaim Health, our focus is how do you support that person with dementia so that they can still be as independent as possible. They can enjoy things, different things, the same things they used to enjoy, or try new things. How do you build value into that life so that, you're not just sitting there and bemoaning the effects of the disease? You need to still be able to live. The focus is on living, right? And that's really key.
So Melissa, when you say build value into that person's life, what are some of the things that families and even Acclaim does to help build value into people's lives who are suffering or have the condition of dementia?
Yeah, well, typically what happens when you are diagnosed with dementia is it can be a really isolating disease, and it's also a disease of losses, right? You lose your ability to do different things. And friends and family may kind of distance themselves. They don't know, it's hard for them. They don't want to see the changes that are happening in you, so they could distance themselves or pull back. So really what Acclaim Health does is focus on building back some of those things that you've lost. So social connections. Come to one of our adult day programs or to the new Patty's Place, and you can meet new people, you can make new friends, you can have discussions, but it's all in a really safe space where if you can't remember something or you make a misstep or your social cues aren't quite there, it's okay. It's a totally safe space. Everybody's friendly, everybody's in the same boat. And that's really a huge part of quality of life for that person living with dementia. And of course, they're people like us. I mean, they've led full lives, they've had careers, they've raised families, they have friends, they've done all these amazing things. And so we really take the time to learn who that person is, what we call it, kind of the spark of life. What makes them happy? What brings them joy? And how can we reconnect them with that where they are, right? And you lose that ability to make choices for yourself when you have dementia sometimes. So how can we bring choice back into it? Come to the day program, you have a choice of different things to do or do nothing at all if that's what you're feeling that day on a rainy day like today when we're filming. So it's building in that choice, trying new activities so they can still accomplish things, new things, things they used to love, building in those social connections. All of those things really make life worth living for all of us, not just with people with dementia, right? It's what everybody wants, and you have to build that back in.
Melissa, is dementia, I mean, it's not like a light switch. One day you're all right, the next day you've got it. And that must be a difficult thing to even identify. How can families, when they think that a person has dementia or the beginning of it, what signs should they be looking for that would help them determine that yes, it is, or no, it isn't, it's just aging, and that's part of life?
Yeah, we all lose our keys, and that moment you lose your keys, you think, especially when you work in dementia care, as long as I have, you're kind of like, but yes, that's a good point. I would say if you're concerned at all, if it's becoming more than just a lose your keys occasionally situation, go speak to your family doctor. There are cognitive tests that they can do. They can refer you to a specialist. And once you get that diagnosis, we often say that those early stages where you have moments where you can't remember or your memories are a bit confused, and then you have moments where you're quite lucid and you go back and forth often in the early stages. That's a really tough time for the person who's been diagnosed, because they know in their lucid moments what's happening, and it's really scary, and they know that the future is going to be challenging. And I think we see a lot of mental health issues in people who have been diagnosed in those early stages when they're still aware enough to know and understand what's happening. As the disease progresses, in some ways it gets easier for the person living with dementia because they're just where they are. And, we meet them there. If you're a family member, you just meet them there. They think, they're playing with their childhood friends in their neighborhood backyard from the, 50s. That's where they are. You just meet them there, right? It's harder for family members, though, in those later stages, because the person they know and love more recently is sort of slowly fading away. So the different stages present different challenges, but definitely see your family doctor. And then I would say reach out to organizations like Acclaim Health, because you're not alone. There are a lot of families going through this. We have a lot of things, including caregiver supports, workshops, consultations with families for specific challenges. There's a lot out there to get you through this, and you don't have to do it by yourself. You can't do it by yourself.
That's very true. So I will share, my grandmother had dementia, and what you described is very accurate. At the initial stages, it was very hard for her to recognize that she was was losing her faculties, as she described it. And I would say in later stages, she would recognize my father, who was her son, as her brother. She recognized me as her daughter. She just didn't appreciate what was going on. And at the same time, she had her own narrative. And I like to think she was really happy because she read the same books over and over. She insisted on eating ice cream at every meal, including breakfast, which I thought was I was envious as a teenager at the time. So, I always had a very different narrative of my grandmother, later stages of life. And I think what you've described is really trying to connect them back to things that make them happy is so wonderful. And the one thing I wish my family had, which is currently here in Oakville and about to open, is Patty's Place. And I really think it'd be wonderful if you could share kind of the genesis of Patty's Place and its namesake, and then some of the services that are available to people through Patty's Place, which I got a sneak peek of, and it's awesome. I'd like to stay there even.
I would too. So Patty's Place is Acclaim Health's new dementia care center. It's based in Oakville and will serve all of Halton. And what's cool about Patty's Place is it incorporates a lot of different services under one roof for families. So there are 2 adult day programs. We call them the clubs because no one wants to go to a adult day program, but everybody wants to go to a club.
Wow.
So 2 clubs where people can go and spend the day. And again, lots of choice of activity, safe space. There's cool stuff there. We're going to have the first ever immersion room designed for people living with dementia in Canada. It's going to be part of Patty's Place, where we can do a complete virtual reality experience for people living with dementia, which will be very cool. So there's some really new innovative pieces in the center. It will also house the first overnight respite beds for people with dementia in Halton. This is a service that doesn't exist right now, so this really is a game changer for families. Because if you need a break from caring for your loved one, right now there are not a lot of options. So it's really key. Your person living with dementia can come stay up to 2 weeks. Gives you
2 weeks?
Get 2 weeks. They get 24. It's like an all-inclusive resort, really, Wendy. Let's be honest. You get all your meals. It's fun. You get to stay. You get to have parties during the day. It's great. But so the person living with dementia has fun. It is a good experience for them. But the family, of course, gets a really meaningful break. And I mean, we have families, people are still working. People may need to travel to see family out of province or out of town and can't travel with the person living with dementia. So it really gives families those breaks so they can keep going. And then there's also a lot of caregiver support. So families can't do it by themselves. They need the education, the resources, the support as the journey changes all the way along, to make sure that they're thriving as well. So that piece is baked in. So it's really exciting, and it's just opening this week.
Melissa, if I can ask you, and this may sound, because I'm not familiar enough with the dementia, what is the difference between dementia and Alzheimer's? Or are they used interchangeably?
That's a good question, and it is one I get a lot. Dementia is kind of the umbrella term for a lot of different diseases, Alzheimer's being one of them, one of the more common ones, which is why everybody kind of associates it with the disease. So, but there's other types of frontal temporal dementia, Lewy body dementia. There's other ones, they're rarer, but also fit under that dementia umbrella. So it's kind of the overarching term.
Okay, so I can use the term dementia to mean a variety of different diseases that all come under that umbrella. Okay,
you got it.
Thank you for clearing that up, because to me they were interchangeable, and I knew that wasn't right. But I appreciate finding out about the differences between dementia and Alzheimer's.
Yeah.
Now, Pam Demoff member of parliament for Oakville, North Burlington, recently put something up on social media. She took a tour of Patty's Place and had some excellent comments about it. So this is all new, and Wendy has just been there. So this is all relatively
before
new.
Pam, though. I was there
Oh.
before Pam.
Okay, well, you were number one. You were number one.
Actually, I think she might have been, but I mean, this has truly been a community effort. And I think that's something that's really important to say, because I mean, the Oakville Community Foundation has supported Patty's Place. We've had funding, you know, from different grants at different levels of government, but it's been, we had to fund, as a charity, we had to fund the whole purchase of the land and building this ourselves. And this community has rallied behind us. It's been extraordinary, and we have been able to raise the money required to do it with the help of many, many, many people. And the story behind the name is that a local doctor, Dr. Patty Plaxton, was diagnosed with early onset dementia, and her friends and family, as a way to honor her, decided to contribute in a major way so that they could name the building after her. So that's just one example, but I mean, we've had people give $1 because their grandmothers have had dementia. We've had people give huge amounts because they see the community need, and everything in between. So it's not Acclaim Health's Dementia Care Center, it's really the community's Dementia Care Center, is what I would say. We owe them a big thank you. Everybody's worked really hard.
Yes, and especially you, Melissa. So thank you, and the great
Many
team.
others. I'm just a small part, Wendy. Just a small part.
I know. So tell us one final thing before I think we're probably going to have to wrap up very shortly. How do people get access to your services? Do they have to pay? How does it work? So
that's a really great question. Yeah, it's a great question. So our services are partially funded by the Ministry of Health, so from the province. So to get access to our adult day program, for instance, you do have to go through home and community care. That's confusing for people. So what I usually just say is go to our website and contact us, because we will help you navigate through that. You can make a reservation for our overnight respite suites from our website. That's very low barrier. And you can also request the family consultations right on our website. So if you go to acclaimhealth.ca, look under dementia care, all of our lists of programs and services are there. And if you're at all unsure about where to start, then just give us a call, email us, fill in one of the forms, and we'll get back to you and help you navigate through that. To make sure you get to the right spot. Even if it's not one of our services, we'll help you access other services that may be of benefit.
So Melissa, you're saying that everything's free, right?
Oh, didn't answer that part of the question, Wendy. We are required to charge a small fee for the day program. It's $24 for overnight respite care. I haven't had to answer this question because it's just open. I think it's like $70, I want to say. Anyway, but we are a registered charity. So we will subsidize the fees. We don't turn anybody away if they can't afford the fee. And for instance, with the adult day program, the actual cost of caring for somebody for a full day is $130. We're only charging families $24. So already it's heavily subsidized. But if the $24 a day is a problem, again, we're here to get people care. It's our primary goal. We'll work with you.
And the corollary, if I may, Mark, is that going forward, you still need people's help to make sure that Patty's Place stays operational and all of your programs are available. So if anybody would like to support Acclaim in this wonderful work, they should really look at their website and make a contribution, and they'll get a tax receipt and everything else. But it is such an important program for our community. So just wanted to make that little shout out. Thank you.
Yeah, thanks, Wendy.
That little commercial there.
That's right.
Melissa, do families have to have a diagnosis before they can access your services?
These services that we've talked about today, absolutely. You do have to have a diagnosis because we want to make sure we know what kind of dementia it is. It does, help us support that person better. So absolutely, you do need a diagnosis to access our dementia care services.
Okay, that because I think that's important for people to know. I'm as concerned about the caregivers
Yes.
as I am the person with dementia. Now, and that 2 week resort
Yeah.
is great for the caregivers, but on an ongoing basis, do you have tools in your toolbox that you can share with the caregivers to help them cope with the disease?
Absolutely. We have a lot of strategies. So, you can't just access one support and be okay. You really do need to, get a day program in place, use the overnight respite, use our caregiver support services. So educate yourself about how to redirect someone's energies with dementia, how to calm them down if need be, what the trajectory looks like. And then we also offer a virtual club. So on the days you're not at the program, anybody in the community can access this. Here are some activities you might want to do with your loved one to help engage them and keep them busy at a variety of cognitive levels. So there's a lot available. And again, all of these things, if you contact us, we can hook you up with what's right for you and your family's situation.
And Melissa, is dementia an old folks disease, or does dementia show up in any age group?
I mean, obviously it tends to be older people who get diagnosed with dementia, but the truth is there's still a lot we don't know about the disease. There is no cure. So you do have to learn to live with it. With the aging population, we are seeing increasing numbers of people who need support for dementia. And as I said, though, there is early onset dementia. So people in their 40s, 50s who, I don't think of those people as old personally, but guess it depends on your viewpoint. But, so you can get it at those ages. It is not as common, thankfully. But yeah, it is something that it tends to be older people who do get it.
Yeah, and I think
Yep.
we've seen Lisa Raitt, the former
Yes.
MP and minister. Her husband has early onset Alzheimer's, I believe.
Mm-hmm.
Yeah.
And she does post about it regularly and blog about it. So she is really doing a great job of raising a lot of awareness about the challenges of the condition at a younger age. So one thing I think you haven't shared is where exactly is Patty's Place, so people know where to go.
Absolutely. So Patty's Place is at 2250 Spears Road in Oakville. So that's between Bronte and Third Line on Spears Road. But we will serve all of Halton. So if you would like to come and stay overnight and you live in Georgetown or wherever that may be, you're welcome to come and stay as well.
It's terrific.
The demographics of dementia, you say it's increasing, but is that because we are more aware of it now, where in the past maybe we weren't quite as aware of dementia? So I'm just wondering how you determine that it is on the increase.
Well, I think it's a lot of different factors. Certainly it is, there is increased awareness. And so people may be going and getting diagnosed where before they would just chalk it up to old age and sort of they and their families would get through it. So that's certainly a factor. We do know that because older people are more likely than other age groups to get the disease as the population ages, and we have greater numbers of older adults, that is increasing the cases of dementia. And in terms of other factors, we don't know a lot about, we know sort of some of what happens in the brain when you're diagnosed with dementia, but nobody's entirely sure what goes into that. Part of it's genetic, but part of it, what environmental factors and things like that. We do know that some of the best things you can do to reduce your risk of dementia is to maintain your social connections. That is key. Keep your brain active, but not just doing things, like doing Sudokus and things like that. They're awesome, but you have to engage with other people. those social connections are really key in healthy brain aging. And so get out there, volunteer, make friends, do stuff with people, which has been hard during the pandemic, I will say. A lot of people have become isolated, but if you can do those things, you definitely set yourself up for success.
And that's why we're doing the issue.
Exactly.
And actually, that's a good segue into the report that the foundation and Acclaim issued earlier this year called the Vital Older Adults Report, where we did research across the community, where we were underway in 2020 and put it on pause because of everything that was going on in COVID, and found that there was decreased activity. And one of the things that the foundation has invested in through its own funding, as well as the Canadian Healthy Communities Initiative, is we're supporting the build, I should say, of Rotary for an older adult recreational facility, an outdoor recreational facility focused on older adults in North Oakville, which we'll see developed in the next few years. So that's kind of an exciting thing as well, that we're beginning to do some more placemaking for our older adult community to keep them active and engaged.
Awesome.
Well, this is a subject we'll continue to discuss as it evolves, not only with our families, but in our communities as a whole. And I'd like to thank Melissa Cameron, Community Engagement Director from Acclaim Health, for bringing this issue to the forefront, because it is an important issue for families to be able to identify dementia. And I'd also like to thank my co-host this week, Wendy Rinella, CEO of the Oakville Community Foundation. And I'd like to remind you that you can watch a new episode of The Issue Tuesday nights at 8 p.m. with repeats throughout the week. I'm Mark Carr. Thanks for joining us on The Issue on YourTV. Truly local. Stay safe and healthy, everyone.